Hi there, folks. This is Dr. Ellenburg. Welcome to the Medical Show here on Fox News Talk 1020 AM. You'll also find us on FM at 95.5. And you'll find us online at foxnewskoan.com. That's foxnewskoan.com. You can live stream us as well. And, of course, your questions or comments today about medicine are always encouraged and welcomed. Our phone number here at the station is 522-1020. It's 522-1020. As a reminder before we get started here today, during the week you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's DR, doctor for short, so drellenburg with a U.com. Check us out, list of our services. We have suggested websites to check out that concern you about your health. Also some suggested reading material. You can learn more about a variety of treatments. And, of course, as always on our website, we do have archived radio shows from the past. And if you've been there anytime recently, yes, I know I'm behind about a year or two at least on some radio shows. We do have some older ones than that are still you can get information from, and it's free to download it if you choose to do such a thing. So, again, check us out at drellenburg.com. And last reminder, I do see patients in Palmer and Kenai monthly. Call our office at 563-2366 for times and dates of when I'll be in those areas. All right, well, let's give you kind of an overview of today's show. We're going to talk about those old plastic bottles are back on the kind of a timeline again, discussion as far as news groups, and looking at Bisphenol A free bottles. We were told that those are supposed to be okay to drink. Now we're hearing there's more things to worry about besides just that in those bottles, plastic bottles, as a matter of fact. Got a nice little piece here today in talking about and following up on our mental health discussion. I was at a recent conference on mental health, integrative mental health therapies, and this did not come from this conference, but came from some data I researched over the weekend. But looking at exercise and dementia, we have a couple of different studies that point to the fact that it's extremely helpful in those with mild cognitive impairment or early memory loss. And we'll discuss those as well. We'll talk today about gum disease, also known as periodontal disease, being tied to a pancreatic cancer risk. The reason to make sure your gums are in good shape. We'll talk today. I got another article on cognition and memory problems and discussing B12 and folic acid. And we'll talk today about a new piece that's just come out, I've not seen this before, linking a certain type of viral infection to causing possibly type 2 diabetes. And if we have time in today's show, we will also get into talking about some natural solutions for migraine headaches and debunking the hygiene hypothesis, basically saying that we've become so clean, that's why we're experiencing more disease today. An article out of the United Kingdom says that's not true. So let's get started today. Again, if you got questions or comments about your health, I have no problem taking a break from what I'm talking about, talk to you about your health. Give me a call here at 522-1020. And away we go. So if many of you remember here, just probably about a year and a half, 2 years ago, there was a big fadoo in talking about plastics that are found in plastic bottles. I want to say that I was even talking about that as being a problem probably about 5 years ago. Bisphenol A is a plasticizer, also put in the group called phthalates, kind of a funny word, where it is part of plastics. And you even find bisphenol A part of the lining of cans of food. And for those who are the upcoming American Thanksgiving, Canadian Thanksgiving is today, so any Canadians out there, happy Thanksgiving to you. But the American Thanksgiving coming up next month, of course, and then, of course, the holidays for December, those using canned goods and foods, those foods slide out of those cans a lot easier because they have a plasticizer that's been sprayed inside them to help food slide out easier. There's no benefit to the food in those cans. It doesn't preserve anything. It's just to help you get it out of the can easier. But yet you have bisphenol A in it. And this article that came out of actually Canada this week is talking about that even these BPA or bisphenol A free bottles that are out there, you can see in different stores, even in the Anchorage area, are they truly still healthy for us? And the answer really is not necessarily so. There are many things, other plasticizers that are leached from plastic bottles regularly. And even if you don't have bisphenol A in a plastic bottle, you're being exposed to other things. And that's why we'll tell people too frequently, if you're going to get bottled water and plastic, for example, small ones at least, use them and recycle them. Don't use them again. The more you use them, the more that you're being exposed to. And the biggest concern, people say, well, plastic's been around for a long time. Why is it a problem? Well, it's a problem because of our exposure to these different types of plasticizers like bisphenol A in a variety of different products, from food packaging to liquid containers to canned food, so where people are exposed to these things on a much more regular basis than they ever been before. And because bisphenol A doesn't tend to stay in the body very long, it kind of takes care of the issue, because if you're being exposed to things on a regular basis, it's going to be in your body for a long time. And there's been some studies even looking at affecting the reproductive organs on even mice. And discussions of where you find these things in the urine of many people. I mean, you can test by most people walking around, even in the Anchorage area, and you'll probably find bisphenol A in the urine because they're consuming some type of food that's in that, or liquid that's in a plastic bottle of some type. The concerns over BPA have compelled places such as Canada and some other countries to even ban the use of bisphenol A in baby bottles, and especially because bottles these days are not made out of glass, made out of plastic. And that's a good point I should bring up. Glass does not leach anything, right? It just breaks easy. And if you wonder why so many companies these days are leaning towards plastic versus a glass bottle, simply because things break a lot easier. But glass leaches nothing, okay? And if you're going to be one of those folks out there who likes to consume healthy essential fatty acids, such as omega-3 and omega-6 fatty acids, things like flaxseed oil or borage oil or hemp seed oil or fish oil, if you're buying those in the liquid form, not in the gel capsules, you want to buy from companies who put their product in glass. Bottom line, no matter what, okay? I don't care if the company says, well, this is in a healthy plastic bottle. It's not, okay? You can't make it that way. Let's put it that way. And when you have things like those fatty acids, those are fatty oils, it's much more easier for plasticizers to get into those than would say water, for example. And I got heavy into this a very long time ago, when I was back in Naturopathic Medical School, and we had a doctor named Dr. Udo Erasmus spoke to us one day at lunch, and a free seminar on the side talking about, and he's worked for the company Flora for years and developed, has a very great book out there on such fatty acids called Fats That Heal, Fats That Kill. It's pretty heady stuff, but it's probably the best written book I've ever seen on essential fatty acids out there today. And he spoke, not in that book specifically, but also when he was at our school, talking about why he had his oils put into glass, because he started researching plastics and went and discovered that not everything on the plastic container was listed as far as what's in it, as far as what it's made out of. And he called up one of the company and said, well, that's proprietary information. We can't tell you what it is. And so after that information, he decided to put all his oils in glass. So getting back to what are some safer sources to putting your water in, is probably the most common thing that people are using some type of reasonable container for daily, and you should be, right, drinking at least maybe a half a liter of water or a liter of water a day if you weigh 120 pounds or more. If you weigh more than that, you might need more water than that. But there are steel containers that exist that you can buy these days, and yes, you can use glass, and yes, if you drop it, it's going to break, but it won't leach anything. And even some folks go as far as say, I'm not even going to drink out of a steel container. I don't blame them for that one either. I don't have information to say that's bad for you. I just know some metals can still get into things that they're holding as far as liquid. Certainly glass is your safest place. So a reminder out there, just because it's bisphenol or BPA free, that's what it stands for, BPA is bisphenol A free, doesn't mean you're not getting chemicals into your water or liquid you're consuming out of those bottles. So get a healthy choice. All right, folks, Dr. Ellenburg here. You've seen today's show. It's the medical show here. Topics are open for suggestions from yourselves as well as folks calling in questions. And, of course, I always have a list of topics discussed today. Our phone number here at the station is 522-1020. Call with your questions or comments. They're welcome in any direction. As long as it's a medicine, it's fair game. All right. Well, let's talk about dementia. As I mentioned a week or so ago, I was at a integrative mental health summit, basically talking about some different ways of treating patients using integrative care. Looking at the use of, say, amino acids, looking at the use of dietary approaches, even in patients who are currently taking medications for depression or even anxiety. And one area that was lightly touched on was a discussion of exercise. And then, lo and behold, this week, a very interesting article comes out looking at 4 different recent studies that were reported at the Alzheimer's Association International Conference. looking at 4 studies linked to exercise improving mild cognitive impairment. So it's not somebody who has advanced dementia, someone with moderate dementia, kind of mild dementia. The kind of folks, memory is just not like it used to be. I'm forgetting things. I'm going to write things down a lot. These are the kind of folks that tend to be helped the most by interventions at an early time rather than a later time. And it's a huge concern. As I mentioned last week, a reminder for those out there, dementia is the category. Alzheimer's is a type of dementia that accounts for about 60 to 80% of the dementias that are out there. So it's most of it, but it's not all of them. But since Alzheimer's seems to account for the most, they're predicting that by 2050, which is not far away, people with Alzheimer's will cost the U.S. over $1 trillion in care. And, with even our current system to be highly unsustainable, to say the least. And the first ever U.S. national plan to address Alzheimer's was unveiled in May and is trying to be implemented. Obviously a lot of research is needed in this area, and they're raising quite a bit of money to try and help that out and find out things. Of course, outreach, education, and community support in general. And when we can start looking at things that save money, and that's the important piece of this too, is each in the healthcare system is how can we also, one, help those people out who have memory loss, and two, how can we save the system money in the process, which is great if we can do both, right? The main thing being, can we help people? That's number one on the list. So what are some of the things they found? Well, they did a couple of different studies. One looked at just moderate walking and looked at 120 older adults without dementia. This is interesting here, who had been sedentary, sitting still basically for the previous 6 months, and assigned them to a moderate intensity walking group or a stretching and toning group for 1 year. They used magnetic resonance imaging, or MRIs, or used to measure the brain region that associated with memory. And the main area that we know of is called the hippocampus. And they measured these both before and after this exercise intervention. So I measured prior, and then after 1 year later, it got measured again. They even drew some concentrations of a laboratory marker called brain-derived neurotrophic factor, and did a variety of different cognitive testing on those before and after the exercise. What did they find out? Well, they found out that in the study group, the one year of exercise training increased the size of the hippocampus. It's the main memory center in the brain by 2% in a walking group compared to those just did stretching and toning. So it was a moderate exercise. Now, they may not seem a whole lot, but it didn't shrink. And one of the things we see frequently in Alzheimer's patients, you can see, not all the time, in MRI on patients, is that the hippocampus can actually shrink in the brain. And this increase in, as they term the words here, hippocampal volume, was also correlated with some changes in the blood test I mentioned earlier. There's brain-derived neurotrophic factor actually increased moderately along with here the size of the hippocampus in the brain. And what it means here is the one lead author says, these findings suggest that the aging brain remains modifiable, and that, he says here, sedentary older adults can benefit from starting a moderate walking regimen. And the fact you can make changes once something actually shows up is the big thing. And we thought for years and years, well, the brain doesn't grow new neurons. A certain number of brain cells, when they're gone, are gone. It's not the case. The brain can repair itself to some degree. It can make new neurons. And so you can begin to see we can make changes, not all just downhill. We just start seeing it. Well, can I stop it? Well, can I improve it? And it's possible. And this piece alone is just talking about exercise. Another study was done here. Looked at resistance training, may improve thinking and memory in older adults with mild cognitive impairment. The study was done in Canada and looked at folks who were doing aerobic training, mostly basically walking, people doing balance and tone exercising, and those that were doing weightlifting as their resistance training. And what they found out again is that compared with the balance and tone groups, the weightlifting groups improved on a number of different battery tests as well as memory tasks. And again, it's also happened in the same group who are doing the moderate walking. So even just walking can do this, not just even doing some weightlifting. They also saw that a variety of training, aerobic strength and balance, in a study done in Japan, also demonstrated that there was improvement in cognitive learning, local memory, and short-term memory as well. So again, what we're getting back to here is talking about how exercise is much more important in this case. Why would it even do that? Well, obviously there's many things about the body we know nothing about. But one area, if you think about it, even moderate walking is going to increase your breathing. It's going to increase your oxygen intake. And remember, oxygen is used not just so you can walk around and breathe. It's used so you can run every single cell in your body. Oxygen is energy for your cells. I would say any type of exercise, with in general, I mean, obviously stretching, I don't really call it exercise. Your heart rate needs to get up a little bit as far as exercise is concerned. So even this moderate walking made a huge difference. And I think you can apply this moderate walking even beyond the case of mild cognitive impairment or early dementia to a whole host of other chronic problems like diabetes, heart disease. Just moderate walking is what's needed. A simple amount of exercise. When I hear patients come in and say, I don't have time to exercise, you need to find time to exercise. When you see studies like this, and I read this stuff all the time. I mean, I'm always sitting around every Sunday, that's my afternoon, is trying to find interesting things as far as my research to present to you folks here on the radio. And when you find things, exercise, I've been talking about exercise, for years on this show. Other piece, of course, too, is cancer. At any point in the process, exercise is extremely important. Obviously, if someone's at a point where stage 4 and they're in hospice, that's not even a question. But, meaning those in remission, those in current therapy, and to prevent getting cancer, exercise is extremely important. So you really need to include that. And a lot of things I hear in Alaska is that, well, in the winter, it's hard to get outside, it's bad roads. Go walk around a mall if you're retired and have time. Just don't go buy anything. Go there 4 times a week, walk around the mall. They're open at 10 o'clock, 9 o'clock in the morning. And there's no ice on those paths, and there's no snow in the way inside those places. So it can work for you as well. So highly consider that. If you yourself suffer from early memory loss or know someone who does, remind them and yourself exercise can help. All right, folks. Again, it's Dr. Michael Ellenburg. It's our medical show here on Fox News Talk, 1020 a.m. Also find us on 95.5 FM. Also find us online at foxnewskon.com. If you have questions or comments about your health, this is the place to call today. It's 522-1020. It's 522-1020. We've got about 5 or so minutes before the break, so we will get into our next piece here. And let's talk about gum disease. Being the fact that my dad was a dentist, always had a very interesting approach to, taking care of my teeth, flossing, and have definitely over the years in trying to find information again for the radio show to present that I find interesting is articles on gum disease. I think over the last several years we've talked about diabetes, we've mentioned high blood pressure. There was even an article I think looked at an increased risk of death just in general in those who had periodontal disease. And a lot of times the question comes, well, why would our mouth be such a place that can happen from? Why is this a big deal? Well, it really comes down to how your teeth themselves are surrounded by the gums themselves in your mouth. And it's one of the few areas, it's one of the only areas in our whole body where bacteria that can get in from your food or from an infection in your mouth can literally get into your bloodstream very, very easy through your gums and lead to chronic problems in your body that, of course, we're highly unaware of in a lot of ways. And what the concern is, if you have very bad dental health or even poor dental health with mild periodontal disease, you may have bacteria get in from your gastrointestinal tract. And guess what? Your gastrointestinal tract includes your mouth. Okay, that's where it all starts at the top end. And there's lots of bacteria in there. There's lots of bacteria all the way from the top of your mouth all the way down to your anus. And that bacteria in your mouth can get into your gums and get into your bloodstream. And what happens from there, a lot is unknown as to what happens next. But in this recent study, they were looking at pancreatic cancer. Now, this is not the first study that looked at pancreatic cancer having a risk, poor gum health being a risk for pancreatic cancer. There was a Harvard study done here a few years ago that was done on men, that men with poor gum health had a 63% increased risk of developing pancreatic cancer. Another study also found that high levels of a certain type of bacteria in your mouth called Prevotella gingivalis, which is was also linked to a greater risk of dying of pancreatic and colorectal cancer, not just pancreatic cancer. And in this recent study, as I'm mentioning here, You looked at 405 people. This appeared in the Journal of Gut magazine, GUT, and they compared people who had pancreatic cancer and those who did not. And the scientists found that there are higher levels of this antibody. This means basically an immune reaction to this bacteria I just mentioned called Prevotella gingivalis, a bacterium that definitely plays a role in gum disease. And it was twice as common to find antibodies to this type of bacteria in people with pancreatic cancer. Now, no one's saying that if you have poor gum health, you're going to get pancreatic cancer. What we are saying is it seems to be a trigger. Could be some correlation taking place that, beyond the fact of cancer, you want to have healthy gums so you don't get high blood pressure, you don't have heart strokes or heart attacks or get diabetes. All these have been linked to poor gum health and now cancer. And what are some good ways to take care of your gums? Well, first of all, obviously brushing and flossing twice a day would be a great thing to be doing, and at least flossing at least once a day if you're brushing your teeth twice a day. Using a water pick can be very helpful. And as far as your gums, what are some things that can be taken to help them out? Well, vitamin C is always one of the number one things on the list for gum health. In fact, in people who get scurvy, their teeth fall out because the gums get weak. And so vitamin C is very helpful to gum tissue. CoQ10 or coenzyme Q10 has been shown us do some wonders for dental health, including your gums specifically. My dad used to prescribe that when he was a dentist himself to his patients for their gum health. Folic acid, usually in some type of a folate rinse instead of just a pill, but actually in a rinse. You can rinse inside your mouth to help your gums out directly. Is a great thing to be using. We use a company at our office as well that's called the Dental Herb Company, Dental and the Herb, H-E-R-B Company. And they make a couple of very great products. One's a dental rinse, basically like a mouth rinse. They have dental toothpaste as well, and then of course they also have a tooth and gum tonic you can put directly into your water pick machine as well. All herbs, all natural, great stuff, and seeing some great results in patients who have gum disease using that product. So Dental Herb Company. So there's a lot of different things to use for your gums, and there's a number of herbs out there that I'm sure I'm unaware of that are very good for gum health as well. But the main things being here, we said folic acid, vitamin C, CoQ10, some great ones for gum health, and of course a good herbal product like Dental Herb Company puts out there. It's a wonderful product to help out with your gum health. And of course, going in at least once, if not twice a year, and having your teeth cleaned is a good thing to be doing. So please consider that. If you have bad gum health, you could have more problems down the road than you want to have. And certainly to add to this list of things that are not good for your gum health, one of those would definitely be smoking. Very hard on the gums, big time. And it takes a lot of vitamin C right out of your mouth, literally because that's an antioxidant. And of course, tobacco smoke is a definite pro-oxidant, no question about it. So highly consider that for your gum health. We have got, 30 seconds? There we go. Good timing. So, folks, that means we're going to our break here at the bottom of the hour. We'll be back in a couple of minutes. Stay tuned.
I'm alone in the dark, even though time and time again I see your face smiling inside. I'm so happy that you love me. Oh, yeah, life is lovely. Oh, when you're near me. Tell me you will stay, make me smile. Do yourself a favor.
Hi there, folks. This is Dr. Ellenburg. Welcome back to the Medical Show here on Fox News Talk, 1020 AM, 95.5 FM. Phone here at the station is 522-1020, 522-1020. Questions, comments about your health, comments about the show. Give me a call. Long as it's medicine, it's fair game, 522-1020. You just missed the first half. Today we talked about the importance of exercise and helping out dementia. Several new studies support the fact that even mild to moderate walking exercise can help that out. We also talked about the fact that plastic bottles are still bad for you, even if they are BPA free. Use steel or glass as your options. And we also talked about the importance of having good dental health, in this case your gums, and hopefully not developing pancreatic cancer, which is a new risk tied to poor gum health. All right, well, let's talk today here some more about back to some cognitive decline. What are some things that can frequently happen, I'll say one in patients, just in general, that will come in who complain of memory loss? And I'm not always going to be seeing patients that are going to be older adults. Sometimes I might see someone come in who's in their mid-30s complaining of some memory loss issues, which is quite disturbing if you're that age, because it's like, well, that's kind of early for any type of dementia some person would have. What are some quick suggestions right off the bat? Well, one is to make sure these patients do not have poor thyroid function, so to make sure they don't have hypothyroidism. We also look at levels of B12 and folic acid in these patients. I look at vitamin D levels in these patients. How is their sleep? If it's bad sleep, that's the reason why you might have poor memory as well. What is their stress load? That plays a factor in your ability to organize your thoughts appropriately and get things in the right folders inside your brain to store them for later information. And those are some of the big ones we got right off the bat. And another part of that, too, would be someone's actual diet they're eating, because if they're eating a really poor diet that's low in protein or very low in protein, that can also lead to some mild memory loss as well. Even low blood sugar issues, like hypoglycemia, can also cause memory problems. So a lot of different things can affect memory. And I was perusing the Townsend letter, which is a wonderful newsletter magazine that's been out for many years that's written for doctors and for patients, called the Townsend letter. You can find it online as well or get a print copy. It's manufactured in Port Townsend, Washington. And one of my old teachers, Dr. Alan Gaby, writes frequently on clinical shorts for the magazine. And this month is looking at a study that looked at folic acid and B12 levels. It appeared in the American Journal of Clinical Nutrition, 2012, looking at the oral folic acid and vitamin B12 supplementation to prevent cognitive decline in community-dwelling older adults with depressive symptoms. So these patients had depression and some mild cognitive impairment. And the group was 900 men and women aged 60 to 74 years old who had a fair amount of they call psychological distress or stress based on the distress scale. A Kessler distress scale is a certain type of test. And they are randomly assigned to receive in a double-blind fashion very small amounts of B12 and folic acid. They received 0.4 milligrams a day of folic acid plus 0.1 milligram of B12, which is like a minuscule dose. 0.1 milligram is equal to 100 micrograms. And probably the biggest amount you can find on the market in the form of B12, any type of supplement out there, is around 5,000 micrograms, and a couple of companies sell to providers like myself at 10,000 micrograms for B12. On the note of folic acid, there's a much more better form of folate these days, an active form, because when you take in folic acid, your body has to convert it to an active form called folate. And so we're now recommending people actually take an active form of folate, also known as MTHF. Forgetting the acronym at the top of my head, but that's an active form of folate. But both groups in this study received B12 and folic acid for 24 months. And the group that was taking the vitamins, in this case B12 and folic acid, had a greater improvement overall in their depressive and stressful, and as far as their cognitive function as well. And an important part Dr. Gaby brings up in his comment section is that several studies have shown that supplementing with various B vitamins can slow the rate of cognitive decline in elderly individuals. And he says further, in the present study, the combination of folic acid and vitamin B12 improved immediate and delayed memory performance relative to people taking a placebo or taking a water pill, basically, or a sugar pill. And it's important because as we get older, all of us, your nutritional status declines and your nutrient requirements increases with the older that we get. Doesn't decrease. The older we get, the more we need. And as a result, many older adults are not consuming or getting the correct amounts of micronutrients that are needed for optimal brain health. It's just not happening. And B vitamin supplementation and other micronutrients is really inexpensive. It's not an expensive process. And it may make a huge difference in the end how your brain ends up when you're older. And you've got to, not just eat a great diet, you need to probably take some micronutrients and some trace minerals for sure. Your food is not what it used to be. I remember many years ago discussing an article from 1936 on the Senate floor in Washington, D.C. They were talking about, in 1936, talking about soil depletion of micronutrients. In 1936, that was 76 years ago. Where are we today? or we're a lot worse in that direction. And whenever I've heard people over the years say, well, I don't take any vitamins and minerals because I get it from my food. Well, unless you grow your own food and add the minerals back to the soil and put potash and a variety of things in that soil to make it a dense, rich nutrient source, you're not going to get all from your food. I don't care what you say. Okay, you're not going to. The second piece of that is what type of micronutrients, what forms are you consuming these nutrients in if you're going to buy a supplement. And going to places, I'm not going to name big names, but the big warehouse places that provide really cheap vitamins, think about it. I'm going to buy some really cheap vitamins to support my health. Now, it's not to say that there aren't some vitamins that actually, if they aren't expensive and cheap, that they actually are okay, because some are, but many are not. Many use forms that are highly unabsorbable in your body, and they're going to pass right through, and they're going to get into you in the first place. But what's interesting, too, getting back this article on B12 and folic acid and helping cognitive impairment, in this case helping cognition in people who are depressed, is that even with looking at, and I know we discussed B12 a lot, but it's worth discussing again, is that when you have a B12 test done, a serum B12 test done, the range that you look at to see where you're at when you get the test is a big range. It's anywhere from 200 up to 1,200, usually 1,200, roughly. And somewhere in there, and there was a study done not long ago, a couple years ago, on the Journal of Orthomolecular Medicine that discussed that patients were having mild memory issues even at a level that was under 400, which was in range for a B12 test. And I've been arguing for several years that we should be having a tighter, narrow range on B12, and that if someone's not up near 1,000, let's get you there. What else does B12 do in your body? B12 helps your body make blood. B12 is an important factor in what's called the methylation cycle in your liver, which is a major detoxification pathway. So B12 is important in neuronal transmission. We've had a swath, recently, not swath, that's the right word, we've had quite a bunch of people recently come to practice who have peripheral neuropathy, which can be caused from diabetes, but also cause some B12 deficiency. And we've had these people on B12 injections, and they've been getting better a lot faster, just taking it orally, for one, and having improvements not just in their peripheral neuropathy, but also energy levels overall, and how they feel and how they think. So there's a lot of different ways where you can use these type of therapies. And yes, there are good B12 ones you can take orally, besides getting the B12 shot. And you want to get one that's either water-soluble, which is the most typical way of finding B12, and a high dose, like something like a 5,000 or a 10,000 micrograms. And first thing is, if you're going to take anything like that ever, go see a provider, get a lab test done. Let's see where we're starting from to get a good idea where your B12 levels are actually at. We could argue that serum B12 is not the best test. There are other tests that can look at B12 indirectly, like homocysteine. Another test called methylmalonic acid can also give us a better idea where B12 levels are at in a patient versus just looking at a serum B12. But once you know where you're at, you can pick the right choice as far as what to use, as far as getting your levels back up as far as B12. Besides a supplement, what is high in B12? Red meat is, and certainly we don't want to eat too much red meat, and in those vegetarian, it's not even an option for them. So we need to consider supplementation for sure in those patient populations. But they also now make B12 in a form that's a fat-soluble form of B12. Well, they literally wrap it in a fat. I know it sounds kind of strange. It's like pigs in a blanket, like wrapping that biscuit around the hot dog. Well, in this case, you're wrapping some type of a fat, really around the B12 is how it's made in the lab, and that allows for greater absorption. And in these products, one of them is called ReadyZorb on the market. That one's from a company from Dr. Mercolo's website. The two that I'm aware of, might be a third one out now too. What that does is it makes it a fat-soluble vitamin, which greatly increases the absorption of it, and usually it's sprayed in a liquid form under the patient's tongue, and that will increase absorption sublingually, as it's called. And so using B12 in that direction is also quite important and easy to do. So definitely consider that for your brain. And again, some reminders, I did say with memory issues to consider nutrient problems like vitamin D, B12, I said folic acid today, of course. I mentioned protein sources. I mentioned thyroid disease being involved and mental health function as well. Several amino acids that can be involved as well, as far as tryptophan, and even GABA is another, that's a neurotransmitter actually, but those can be measured also on some tests. So there's a lot of variety of things that can affect memory. And, of course, I mentioned even protein intake. Low protein intake can also affect your memory as well. So consider that a dietary approach. Okay, we'll move on here, folks. Again, this is Dr. Michael Ellenburg. It's a medical show here on Fox News Talk, 1020 a.m. Also find us on 95.5 FM. You can listen to us online as well, live streaming at foxnewskoan.com. That's foxnewskoan.com. Our phone number here at station today is 522-1020. It's 522-1020. Questions, comments about medicine, give me a call. All right, well, let's talk, because we got time here to do this today, about a very interesting topic I've not seen before anywhere, and that is looking at a common virus being linked possibly to causing type 2 diabetes. And this is a big deal because, as you know on the show, if you listen regularly or not, I talk frequently about type 2 diabetes. And it's not just explained by the food. There's other things at play here. And, essentially we know for a fact that part of the pathogenesis, the disease process of type 2 diabetes, is the fact that your cells and where you store the most glucose in your body is in your liver, your fat, and your muscles. And the process breaks down where the insulin that's secreted from your pancreas tells the liver, the fat, and the muscle cells to store glucose. And what happens is, for some reason, the liver, the fat, and the muscle cells become desensitized to insulin. They don't sense it like they used to and no longer are storing glucose appropriately. And then your glucose levels go up in your blood and you eventually get symptoms. And if you're not seeing a doctor, you get more symptoms. And you get your blood sugar measured as high. Okay? So that's the piece that's taking place. I'll talk about here on the show over the last year or so different things in the environment that can affect and cause type 2 diabetes. These are various chemicals we're exposed to from food or packaging or even the type of work someone might be doing. Remember, when I say environmental medicine these days, environmental disease, I mean anywhere you exist. That means when you sleep at, where you work at, air you breathe, what you drink, the water, the whole works. If an article appeared actually this year in Environmental Health Perspectives, it's a wonderful environmental medicine journal out there, one of the best ones around in my opinion, talking about obesogens, various chemicals now being grouped into categories of obesogens that are causing obesity and also being linked to causing type 2 diabetes, where somehow they get involved in desensitizing the cells to insulin and therefore decreasing the ability for you to store your sugar appropriately, glucose, same thing, and then having that go up, where eventually now you officially have type 2 diabetes. Well, in this article, where did it appear at here? So let me get that information out. It appeared in their Journal of Immunity and Aging in August. Looks at a common infection known as cytomegalovirus, or CMV, which is a chronic infection that can be found in a lot of people. It's a type of herpes virus that typically doesn't have to have a whole lot of symptoms for patients to even have it. In fact, a lot of people experience no symptoms at all that we're aware of, at least. And so this has been linked to an infection, and a study was done in adults aged 85 and older who were infected with CMV in the Netherlands. And they looked at how CMV, a cytomegalovirus infection, might play a role in how type 2 develops in the elderly, which we occasionally see in some patients where they've been good their whole life and then they get in their late 70s, early 80s, and now they have diabetes, where before they never had it before. And not necessarily because they've changed their diet or had a horrible diet the whole way through or anything. It develops out of nowhere sometimes, and we're not sure why it's there. And now we have this new study that said, hey, maybe it's a virus related to it, and maybe somehow that virus can be involved in causing the ability for your cells to sense insulin. Obviously, as far as risk factors for diabetes, we have obesity as being a huge one, of course. Lack of exercise, bad diet, huge pieces that we already know that are involved in this. But linking diabetes with an infection is definitely a new thing that we've seen now. And in previous studies, they have linked this type of virus, CMV, with type 1, but some of the studies that had looked at type 2 diabetes and CMV had some results that were not very consistent. And one of those earlier studies, you might say, well, I don't really care. I'm not age 85 or older. I'm age 50 or well. There was a previous study looked at between ages 45 and 84, and they were suggesting no link between the infection and type 2 diabetes. Studies are good and bad sometimes about trying to suggest things, but we do know that any type of a chronic infection in the body, in my opinion, is going to impair the immune system of the body, how it actually operates. And we discussed in the show, a lot of times talking about cancer and the variety of different viruses that some patients with certain type of cancers can have that can preclude them or increase your chances of getting some type of cancer. So it would make some sense if even having CMV on board, and we don't think it's causing a problem, maybe it actually is in patients that we're quite unaware of in some fashion. Maybe it's causing problems with increasing the risk of developing diabetes. We don't know yet, but definitely more studies are needed in this direction. It would be nice to see a larger study done on more patients. This study used 550 elderly adults in the Netherlands. Nice to see a study done on a couple thousand people and see how common this infection really is in patients. And it's something that is regularly screened for, of course, in AIDS patients. And occasionally you'll see CMV checked for in cancer patients, but not regularly. If you were wondering, well, what are some viruses that are linked to cancer? Well, I've mentioned before in the show many times, Epstein-Barr virus, or EBV, is linked to lymphoma. Hepatitis C being linked to liver cancer. We've had some, there's one I'm forgetting on lung cancer. It was recently, I'm especially on the show, if I'm forgetting that one off the top of my head. And there's even one virus linked to possible sometimes like gliomas or brain cancers. So we have different things that are showing up in people's bodies that increase your risk, of course, of developing cancer. And, of course, if you have diabetes type 1 or type 2, you are at increased risk of cancer because you have more sugar around, more than you'd like in your blood, and that's the main fuel source of tumors. So that's why you want to have that under lots of good control, so you can increase your chance. One other risk factor for developing cancer, when these days it's very quite common for someone to get cancer, unfortunately. But interesting study. We'll certainly talk more about different studies as time goes on and the type of viruses, in this case, that are linked to possibly causing type 2 diabetes. All right, folks, we've got about 7 minutes left in today's show. If you have questions about your health, now is a good time to call. The number here is 522-1020. It's 522-1020. While wait, we will go forward here with a few more topics we can get to today. Let's talk about migraines. I think it's a topic that many people would appreciate hearing about because some of us usually know somebody in our lives, be it family members or some friends, who have dealt with migraines in their lives, and hopefully they've come across what their problems are. But they can be very hard to treat in a lot of patients. And the biggest thing is that a lot of times, not say risk factors, but triggers are not often looked at. And one area that's important to certainly bring up is food. And you know that I'm a big promoter of people figuring out if they have food allergies. And one of the best ways is elimination and challenge through a diet, not through a blood test. And trying to figure out what type of specific foods might trigger, in this case, migraines. Now, there have been known for years there are certain, of course, food groups that are more common in causing migraines than other ones, or just foods in general, or substances, one of them being chocolate, alcohol, caffeinated beverages such as sodas, of course, refined sugars. Gluten has been linked frequently to migraines, and I know that aged cheeses for a long time and peanuts have been culprits that have been suggested as being causes of migraines. If you were to go on an elimination and challenge diet, you basically eliminate all major allergens such as wheat, corn, dairy, coffee, eggs. You basically eat a very clean diet for a couple of weeks. And if you get frequent migraines and you actually go on this type of diet and your migraines improved, you know for a fact that there's food allergies involved in your migraines. I'm not saying they're the exact cause of all your migraines. They may have a piece in it. And if you've never done a diet like this and you have chronic migraines, you should look into it. It's called an allergy elimination diet. Okay. The only sacrifice is you have to literally just clean your diet for a couple of weeks, which doesn't cost you a whole lot instead of buying some new food, basically. And you might find some great information out. And the biggest thing is how you challenge foods back in is one group at a time every 3 or 4 days, such as dairy picked on one day, eat a bunch of dairy one day, don't have any more for the next couple of days, and see how you feel. That's the main way of doing it. And if it ends up being no reactions of any kind you can experience, that one's added back in. Now the next group, and so forth and so on. That's one way of doing that. On top of foods, we also have for migraines that can be triggers are food additives and sweeteners. Things such as aspartame have known to cause migraines in patients. Even Splenda, older ones, saccharin. Artificial sweeteners such as MSG or monosodium glutamate have also been known triggers in patients, or even food coloring or dyes. So if you're eating foods like that and people are getting frequent migraines, consider eliminating processed food at a minimum and see if things improve. Another part we see in a lot of patients too is some nutrient deficiencies of certain types of a vitamin or a mineral or even maybe amino acids. And one thing we do see in some folks directly is tryptophan, which which is an amino acid, and that can affect the output in your brain of dopamine, which can be involved with serotonin, which has some involvements with migraines. And a lot of migraine relief often results from the flow of serotonin, which will, of course, improve mood. But tryptophan can be something you can get either in supplementation or either through food in this case. That may be very helpful for migraine sufferers. I've used in my own practice for over the years two particular nutrients. One, a B vitamin called riboflavin, which is B1. And I have used that over the years, and even Dr. Gaby taught us that years ago in one of our classes at medical school, and using riboflavin in patients with migraines. And I would suggest probably about 40% of the patients I recommend riboflavin to over the years had great benefit and decrease in migraines, just adding that nutrient in alone and not doing any food allergy stuff, which I still recommend these days I would on top of that. But riboflavin could be very helpful. Other one's magnesium. And magnesium used in your body in over 300 different reactions. It has a hand in all kinds of things in your body, energy, from detoxification, your muscles, your brain, how your vessels work, how your heart beats. I mean, it's got involved in so many things. But I've seen magnesium do wonders also, too, at decreasing migraine occurrence in patients who have frequent migraines. So certainly something to consider for sure in the case of what to do for migraines. And there's one herb they mentioned here in an article I pulled up from naturalnews.com that is talking about an herb called butter burr. Butter, like B-U-T-T-E-R, burr. That has been used with some success in treating patients with migraines. Although, and it seems to help by decreasing inflammation and stabilizing some kind of blood flow to the brain. I don't know. In my sense, it almost seems like it's not. It's more like a symptom approach than it really is a nutrient issue, because you're not deficient in butter burr. Although you could have things in butter burr that are mineral-wise you are deficient in. That's why you improve while you're taking it. But be careful. Some people do have allergies to butter burr as well that could contribute to causing headaches. So it's important to realize that when using different things to treat these. Of course, you've never seen somebody for your migraines and you have chronic migraines, see a provider. Get checked up first. Could be some other problems going on that are causing your migraines as well. And I cannot, I'd be remiss if I didn't mention in this case, with migraines, water. Just good old water. Many folks are under chronic dehydration, and that will increase headaches for sure, and probably is a trigger for migraines. So definitely consider that as a source to prevent migraines and even treat migraines. All right, folks, we've got probably about a minute and like a half left. Just some reminders today. During the week, you can find me at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. Our website address is drellenburg.com. That's drellenburg with a u.com. We're here every Monday at 2-3 p.m. I appreciate you listening today, and we'll be back in 2 weeks. I'll be gone next Monday, but we'll have a show on that'll be a repeat. But if you haven't heard it before, please tune into that, and I'll talk to you live again in 2 weeks. Take care.
A folded hand, a poker there. All new directions must go everywhere. Big round people in a cool little square. Or you can cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family.